The rise in Caesarean section, C-section, deliveries has become a matter of concern in recent years. While C-sections can be life-saving in certain situations, the increasing rates of this surgical procedure worldwide have raised questions about its appropriateness and potential risks. It is crucial to address the factors contributing to the rising rates of C-sections and implement strategies to promote evidence-based obstetric care, reduce unnecessary interventions, and improve the overall quality of maternal and newborn health outcomes. Understanding the factors. Several factors contribute to the escalating rates of C-section deliveries. These include medical, social, cultural, and economic influences. It is important to delve into each of these aspects to develop effective interventions and reverse the trend. Medical factors. Maternal and fetal indications. The primary goal of a C-section is to ensure the safety and well-being of the mother and baby. In cases of maternal or fetal distress, cephalopelvic disproportion, placental abnormalities, or other medical complications, a C-section may be necessary. Previous C-section. Women who have previously undergone a C-section are more likely to have another C-section due to concerns about uterine rupture during a vaginal birth. This contributes to the increasing rates of C-section deliveries. Social and cultural factors. Fear of labor and pain. Many women express fear and anxiety regarding labor and vaginal birth. Societal perceptions, horror stories, and a lack of education about the birthing process can contribute to a preference for C-sections as a perceived, safer option. Socioeconomic status. Women from higher socioeconomic backgrounds may opt for elective C-sections due to convenience, control over the timing of birth, and perceptions of a more privileged birth experience. Cultural beliefs and practices. Cultural norms and beliefs surrounding birth may influence the preference for C-sections. Certain cultures associate C-sections with prestige, avoiding perceived damage to the mother's body, or adhering to traditional practices. Provider-related factors. Defensive medicine. Physicians may choose C-sections to minimize potential lawsuits and medical liability. Fear of adverse outcomes and subsequent legal repercussions can lead to an increased tendency to perform C-sections even when not medically necessary. Lack of communication. Inadequate patient-provider communication, limited discussion of birth options, and a lack of shared decision-making can contribute to the overuse of C-sections. Addressing the issue. To address the rising rates of C-section deliveries, a multifaceted approach is required, involving healthcare providers, policymakers, communities, and individuals. The following strategies can be implemented. Promote evidence-based practices. Educate healthcare providers. Continuous medical education programs should focus on evidence-based obstetric care, including best practices for vaginal birth, labor management, and the appropriate indications for C-sections. Clinical guidelines. Develop and disseminate clear and comprehensive clinical guidelines that support the appropriate use of C-sections, taking into account the latest research and recommendations. Improve access to high-quality maternal care. Strengthen primary healthcare. Invest in comprehensive and accessible primary healthcare services that provide antenatal care, childbirth education, and support for women throughout the pregnancy journey. Increase midwifery care. Promote midwifery-led models of care, which have been shown to be associated with lower rates of C-sections, while ensuring collaboration with obstetricians for high-risk cases. Enhance communication and shared decision-making. Patient education. Develop educational materials and campaigns that provide accurate information about the benefits and risks of C-sections and vaginal birth. This should include debunking myths and addressing fears associated with vaginal delivery. Informed consent. Ensure that pregnant individuals are fully informed about the available options, potential risks, and benefits of both vaginal birth and C-sections. Encourage shared decision-making between healthcare providers and patients. Address sociocultural influences. A. Public awareness campaigns. Launch community-driven campaigns to challenge societal perceptions and misconceptions about birth, with a focus on promoting the benefits and safety of vaginal birth. Supportive environments. Foster birth environments that promote respectful, compassionate, and evidence-based care, which empowers women to make informed choices. Conclusion. The rising rates of C-section deliveries pose challenges to maternal and newborn health. By understanding the multifaceted factors contributing to this trend and implementing comprehensive strategies, we can promote evidence-based obstetric care, reduce unnecessary interventions, and improve maternal and newborn health outcomes. It is crucial for healthcare providers, policymakers, communities, and individuals to collaborate and prioritize the well-being of women and their babies, ensuring that C-sections are performed only when medically necessary, while respecting women's autonomy and preferences. Thanks for watching. Please subscribe to the channel.